Hey folks, Dr. Dan from DocTalk. Thanks for joining us today. Today my guest is going to be Dr. Dave Rethorst, who is the Director of Outreach and a veterinarian from the Beef Cattle Institute here at Kansas State University. We're going to talk about a very common disease, blackleg in beef cattle and other clostridial diseases. I'm glad you joined us. Stay tuned and enjoy our show.
Closed captioning brought to you by Kansas Soybean Commission, the Soybean Checkoff Progress, powered by Kansas farmers. This segment brought to you by Kansas Regenerative Medicine. Your stem cells, your health, your life.
Folks, welcome to DocTalk. Dr. Dave, welcome to DocTalk again.
Glad to be here.
It's always good to have my friend and colleague, Dr. Dave Rethorst, who's a veterinarian here at Kansas State University in the College of Veterinary Medicine and is the director of our outreach program at the Beef Cattle Institute. And Dr. Dave, we're going to talk about something that you've had a little bit of experience with.
Just a case or two.
We're going to talk about blackleg. And it's one of those things that there is not a more used vaccine in the United States beef industry.
No, absolutely not.
And there's good reason.
Right.
But one, it works.
Yeah.
You know, we have, let's go back kind of the history and what blackleg is and what it causes.
Well, blackleg is caused by a member of the Clostridial family, Clostridium shovii, and it's a soil-borne organism. So, you know, when we get real dry soil conditions like the drought we've experienced, we get more of these spores coming to the surface. We see, but a veterinarian by the name of O.M. Franklin developed the first blackleg vaccine back in the 1800s because these calves were dying and they were finding these real dark gaseous lesions in the muscle, and he figured out that he could make a vaccine with these clostridial spores and prevent the disease. So very common disease and a vaccine that works very effectively.
And one of the things that always amazed me in cow-calf practice and that is you can't predict. There are some pastures that have a lot of spores that are blackleg pastures and some pastures that don't. And within the same section of land, you could have people with quarters or with 80s, and here's a blackleg hot spot and here's not.
Right. There's areas that are endemic. I'm familiar with an area in the northwest corner of the Flint Hills that there's quite an area that is blackleg endemic. You just have to vaccinate pasture cattle, you know, and even the soil that's in their feedlot pens has blackleg spores in it.
Yeah, and it's also one of those things. It always seemed like that when we have a calf die of blackleg, it's always the best calf, the most aggressive growing calf, and that probably has something to do with it foraging and just putting itself at risk.
Right.
So when you know, kind of talk to me about, you know, you've had some blackleg cases. Dead calf in the pasture is kind of the...
Dead calf in the pasture is usually what we find. There's times we'll see a calf that, you know, is walking real stiff, particularly in the hind legs or something, and be drought conditions. And, you know, particularly if you've lost a calf already, you'll start seeing these lame calves. And sometimes we can shut that off with some vaccine and some antibiotics when we see these calves alive, but usually our first hint is just finding a dead calf in the pasture.
And then from that, getting a diagnosis can requires getting samples, getting them to the D-lab. But
absolutely, get a necropsy done, get the samples to the D-lab, make sure that's what we're dealing with.
Yep. And it always amazed me that when you would make an indention on there, you could hear the crackles underneath the skin and leave an indention in the spot where you
crack and pop, and you cut into that muscle, and it's just a real dark, dry, gaseous muscle.
Cool. Well, let's take a break. When we come back, we're going to start talking about vaccination protocols for blackleg. Stay tuned.
Broadband has become as important to us as highways. That is why DocTalk is teaming up with NTCA, the Rural Broadband Association, and rural broadband companies like Blue Valley Telecommunications in fighting for quality broadband access through the program Smart Rural Communities.
I don't think we have any idea what's coming in the future. I couldn't have imagined 5 years ago what we're doing today. So in 2 years, I would guess there's things we can't imagine that we're going to be doing.
To learn more, visit ntca.org/smart or bluevalley.net.
Here's another gardening tip with Annette Jackson from Jackson's Greenhouse.
Fairy gardening is now one of the fastest growing hobbies in the country. It is a great way also to introduce your children and grandchildren to the exciting world of plants. Basic fairy gardening is simple, affordable, and may be expanded as your interest grows. Let us help you. Jackson's has the best selection of many plants and accessories in Topeka.
Visit Jackson's and check out our great fairy garden collection. Bring the kids and grandkids too.
Jackson's Greenhouse has what you need today.
DocTalk, brought to you by Santa Fe Trail Meats in Overbrook, or visit us online at sftmeats.com.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson and Dr. Dave Rethorst, and we're from the Beef Cattle Institute at Kansas State University, where Dr. Rethorst is a veterinarian and serves as the director of outreach for us, and spends a lot of time. He's got a lot of experience in the field, as 35 years of veterinary practice, 40 years of veterinary practice, and still continuing to see cases and function in the field with people here in our industry. But let's get to some of the strategies of preventing blackleg. And I think the biggest strategy that we want to talk about first is, let's start out with, the baby calves and work through branding. We'll just kind of go from birth to slaughter, and we'll cover this. But when if we have blackleg and we know blackleg's in the pasture, how early can we vaccinate these calves?
We can vaccinate these calves at birth if we need to. One of the members of the Clostridial family is Clostridium perfringens, and that plays into our overeating, causes our overeating and some of the things we see in baby calves. So we've got a lot of producers using blackleg vaccine at birth just on preventing the overeating form of the disease, but they also get some true blackleg protection there. So if we're in one of these real endemic areas, we can do it at birth. Typically what we do is at spring branding time, we'll come in and give those calves a 7-way blackleg, and then we've got good protection until fall, and usually we'll give those calves another blackleg as we're getting ready to wean.
Okay, so if we're in an endemic area and we're going to give these calves, we can do it right off the bat when we're tagging them.
Right.
And that's a good chance to grab them and give them a blackleg. And that's where I hear most people, if they're going to give one earlier than branding, which folks at branding, we're talking 3 months of age, okay? 3 to 4 months of age. And so another opportunity is at branding, because then those calves are starting to forage a little more.
Right.
Not just relying on mother's milk. They're starting to nibble and graze and get closer to those spores.
Right.
And so we're definitely, and we're coming into that drier time of the year usually.
Absolutely. Right.
So you said a 7-way product.
Right.
And so go ahead.
Okay, so the 7-way product is 7 strains of Clostridium. We've got our Chauvii, which causes the blackleg, and then there's Septicum and Novii, and 2 strains of perfringens, and a couple others in there that
that are more not necessarily causing issues, but when we developed these vaccines, they were easy to grab a hold of, and,
right.
and we have those antigens in there, and there are also products that leave those antigens out.
Right.
I mean, you can get a 2-way or
4-way
or 7-way,
right.
To cover for those different products. But the big thing is work with your local veterinarian.
Right. Work with your veterinarian. There's some places that they'll routinely vaccinate cows for blackleg every year just because of the true blackleg disease. In these drought areas, they're vaccinating mature cows every year.
Yep. Folks, we're going to take a break. When we come back, more about blackleg with Dr. Dave Rethorst, and we're going to move into the stocker and feedlot phases. You're watching DocTalk. We're sure glad you joined us.
The BQA Tip of the Day, sponsored by Beringer Engelheim Vetmedica Inc.
Hello folks, Dr. Nels Lindberg here from Great Bend, Kansas with Production Animal Consultation and Animal Medical Center. Today's BQA Tip of the Day, we're going to talk about pen surface management. And pen surface management doesn't just have to do with feed yards, it has to do with cow-calf producers that have any sort of pens, stockers, starter yards, and feed yards. We all need to do a great job of taking care of our pen surfaces. We can often forget about them. We have many other things to take care of, but again, we want to maintain an excellent pen surface for these cattle. It's good for their welfare, it's excellent for animal health, and if we don't take care of them, can also negatively impact animal performance. We must groom these pens periodically. Pen populations, how often cattle are in them, will often dictate that. Bedding cattle will dictate that. If we're feeding them big round bales and pens, will dictate that. But again, we want to have a clean, dry pen surface for these cattle. Whether it's a cow-calf herd and baby calves, feeder cattle, stalker cattle, whatever it may be. If we have a lot of buildup, whether it's manure or feed particle or bales, bacteria, viruses sit in there and they continue to cohabitate and infect new cattle or the same cattle or baby calves, creating unhealthy situations for all the animals. Let's do the right thing, take care of these pen surfaces, groom them frequently, and make them look like this pen right here. Thank you much.
No matter where, no matter why, the Veterinary Health Center at Kansas State University is committed to providing quality patient care to animals and exceptional customer service to their owners. From routine checkups to emergency and specialty care, our world-renowned specialists and experienced professionals are here to discover, to teach, and to heal.
Let us know.
How can I help?
How can we help?
Tallgrass Commodities offers producers bulk commodities at a reasonable price with reliable service throughout the whole Midwest. To find out more about Tallgrass Commodities, visit tallgrass.us or call 785-494-8484.
The Kansas Wheat Innovation Center in Manhattan is rediscovering ways to get improved varieties and new genetics in the hands of farmers faster. Grower-led and checkoff-funded research initiatives are bringing about positive change. This grassroots leadership provides a strong voice in Topeka and Washington, D.C. Now is the time to partner with Kansas Wheat in moving wheat forward. Kansas Wheat Commission and Kansas Association of Wheat Growers. Farmers investing in their future and yours. Log on to rediscoverwheat.org.
I'm Dr. Frank Lyons, a physician here at Kansas Regenerative Medicine Center. As one of the only standalone stem cell centers in the U.S., we use your stem cells as therapy for arthritis and some autoimmune diseases.
I'm Dr. Andrew Pope, here at Kansas Regenerative Medicine Center. Utilizing the latest technology under strict protocols, we're able to harvest your stem cells from your own fat to treat a variety of medical conditions. The best part about it is, it's a same-day surgical procedure and requires no general anesthesia.
Soil is the life of a farm, and for 25 years, SureCrop Liquid Crop Nutrition has helped growers produce abundant quality crops while preserving and improving the soils they steward. SureCrop offers complete soil and plant analysis with cropping recommendations, delivery direct to your on-farm storage, and quality crop nutrition custom blended for your field. Choose SureCrop for the assurance of excellence for your soil. Call today or visit their website for more information.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
DocTalk, brought to you by the Kansas Soybean Commission. The Soybean Checkoff, progress powered by Kansas farmers.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson, Dr. Dave Rethorst. We're with the Beef Cattle Institute, where Dr. Rethorst is a veterinarian and also director of our outreach. And we're talking about blackleg. And one of the things is we left the last segment talking about ranch strategies and things like that. Really work with your local practitioner. They understand the geology, they understand the geography, they understand the endemic diseases, especially if you're new to an area. Make sure you get a practitioner that you can visit with and really understand where you're living, the environment that your cows are in, and there are a lot of regional vaccination programs that the veterinarian can provide a lot of insight towards.
Absolutely.
So when these calves go to the feedlot, you said we're going to give them a blackleg when we wean them. So if they've, you know, talk to me a little bit, because there's a lot of you know, debate out there as far as blackleg on arrival to the feed yard or to the backgrounder operation.
Right, and we can, as a general rule, assume that nearly all calves have a blackleg early in life.
Right.
But the difference starts coming as we prepare for weaning. Crusty old curmudgeons like me still like to give a blackleg when we're getting those calves ready to wean. Just to get another booster into them, we know we're in good shape. There's places that don't, and you know, and these calves going into the feed yard, we can see blackleg cases in the feed yard. These calves go in there, and if they've had to put new dirt in the pens and it's, like I said, really dry, these calves start licking the soil for some reason, and we can start seeing blackleg outbreaks in the feed yard if we haven't kept the vaccinations up.
And I've seen it too, where we build new pens. So we expand the feed yard into a new area, and we've just roughed up the soil in that area and placed naive calves on that. I've also seen where we've gone in and scraped pens in unprotected or non-vaccinated calves and had some pin-to-pin blackleg outbreaks. And so, you know, I guess my recommendation is if I don't know the history of those calves, or I know that they haven't received blackleg,
Get another dose in them.
Definitely going to use one with the lack of expense to this product. You know, the other thing is, and you can comment to this, but as we've gone through the last 30, 40 years, we've changed the blackleg vaccines.
Right.
They're not the 5cc intermuscular products. Now they're 2 cc's and sub-Q.
Right, and really tissue-friendly products, and our cost is still minimal on the things. So they're really safe to use. You know, a study we did years ago when I was in Nebraska was looking at weaning weights, comparing 5cc 7-way to 2cc 7-way, and just that difference, there was 7 pounds of weaning weight just by what blackleg vaccine we chose.
Go into that smaller dose.
Go into the smaller dose.
So we'll wrap up here, folks, but one other thing is that revaccination, however, in the feedlot is not only not necessary, but can decrease intakes and knock cattle off feed. So if you're going to use a blackleg, work with your local veterinarian, use one on arrival at the feedlot if you don't know the history or if you know the animals haven't had one. More on blackleg and clostridial vaccines with Dr. Dave right after this message.
This Meet the Future Veterinarian is brought to you by Zuprevo. Choose confidence. Choose Zuprevo for BRD treatment. Rebecca Calder was recently awarded an AmStut scholarship. She grew up in Vermont and fell in love with cows at the age of 5. In high school, she spent a weekend with a veterinarian and knew her future was sealed. In college, she received an internship at the Plum Island Animal Disease Center. Rebecca hopes to work in a dairy or mixed animal practice in the Northeast after graduation.
Healthy cows start with the new hired hand automatic livestock sprayer. Rancher invented to provide an efficient alternative to pour-on and injectable parasite management systems. The portable design allows cattle to treat themselves head to hoof. Strategic device placement with pass-through activation technology takes the stress out of parasite treatment for cattle and the rancher. Get the new hired hand for yourself or become a distributor. Visit cowsprayer.com. The new hired hand makes healthy cows easy.
Kansas Farm Bureau, the voice of agriculture, represents grassroots agriculture. The state's largest and most powerful farm organization stands up for its members through leadership development, agriculture education, legal defense, environmental advocacy, farm safety, and risk management. Members also enjoy money-saving benefits. To join our organization today or to learn more, go to www.kfb.org or find us on Facebook and Twitter.
Buying a car shouldn't be this hard.
And at Brown Chevrolet Buick in Wamego, it isn't. It's actually awesome. Whether you want a new or used car or truck, Toby's team can make the deal. Even if you want to custom order a new car or truck, Toby's team can make the deal. See Toby's team at Brown Chevrolet Buick in Wamego. We're awesome.
Here's another gardening tip with Annette Jackson from Jackson's Greenhouse.
Fresh herbs are healthy and add zest to almost every recipe. The folks at Jackson's grow more than 50 varieties of herbs right here, and many are available year-round. Our staff has hands-on experience and can't wait to assist you with your herb needs. Stop in and see us at Jackson's. We're open 7 days a week.
The biggest, largest selection of homegrown herbs is at Jackson's Greenhouse, with 4-inch pots starting at just $3.79.
Jackson's Greenhouse has what you need today.
Kansas Farm Bureau, the voice of agriculture. To join today or for more information, go to kfb.org or find us on Facebook and Twitter.
As we came back from break, Dr. Dave, one of the things that you were involved with recently was a case of blackleg outbreak in a feed yard.
Yes, in feeder cattle. These were 6-weight feeder cattle that the guy bought in December in a feedlot in the northwest corner of the Flint Hills here. And within the last month, he had calves started dying, and I got involved with the local practitioner. And it turned out that it was blackleg in the feed yard. They hadn't cleaned pens or anything, but the cattle, they didn't have a vaccination history on them when they bought them, and they did not vaccinate the cattle on arrival. And with the dry conditions we're seeing, we saw blackleg, very expensive lesson. I think they lost like 8 or 9 head at $1,500 a head. That's
can make the vaccine look pretty cheap pretty quick.
Yeah, 50 cents a head would have shut it off.
All right. Well, one other clostridial bacterium that we typically, we get vaccinated for all the time is tetanus.
Right.
And people don't know that tetanus, a lot of people don't know that tetanus is a clostridial species or that. But when are we going to use the tetanus vaccine?
There's, again, endemic areas. There's ranches I worked with in Nebraska. We used tetanus vaccine routinely, even when we were castrating calves, or a lot of times just routinely because we could see tetanus from an umbilical infection. More commonly, with the advent of the banding that we're doing on bigger cattle
for
castration, we need to be giving a tetanus vaccine when we band those cattle.
Right. And a tetanus toxoid is the preferred method because it takes the animal 7 to 10 days to build an immune response to the tetanus toxoid, so
right.
The 8-way clostridial, or the 8-way blackleg with tetanus. By the time that we would have a tetanus problem, which is 2, 3, 4 weeks out post-banding, that animal will have a chance to build immunity.
Absolutely.
Okay.
Yeah.
And I think that's one of the things that, you hear people say anatoxin or toxoid. Really, the toxoid is appropriate.
Yeah.
The anatoxin's extremely expensive and
in short supply a lot of times, and the toxoid works well, and basically we can get that Clostridial tetani. It's an addition to our normal 7-way vaccine, becomes an 8-way, and it's readily available.
Sounds like a winner. Any closing comments on clostridials?
Just that, talk to your local veterinarian, make sure you're using an appropriate vaccination program. The vaccine works well, and it's very cost effective.
Cool. Well, thanks for being here.
You bet.
Folks.
My pleasure.
Thanks for watching DocTalk. Remember, if you want to know more about what Dr. Dave and I do here at Vet School, you can find us on the web at www.vet.ksu.edu. Remember to always work with your local practitioner. Thanks for watching DocTalk today. I'm Dr. Dan Thompson, and I'll see you down the road.
Closed captioning brought to you by Kansas Soybean Commission. The Soybean Checkoff Progress, powered by Kansas farmers.